This is Mind and Wellbeing. I'm Jodina Scazzola. Research shows the benefits of mental imagery as a mindful practice that can contribute to reduction in anxiety, stress, depression, physical pain, and an increase in immune system functioning. Joining us today, Dr. Michelle Warfield, an expert in mind-body health and healing. Dr. Warfield specializes in the mindful practice of mental imagery for optimal psychology and physical health and healing, including the practice of mental imagery in the treatment of trauma. Dr. Warfield, thank you for being here with us.
Thank you, Jodina. It's really nice to be with you today.
What exactly is mental imagery?
Well, mental imagery is a mindful practice. It's the use of the mind, and it's the use of the creative imagination to create our desires, to create the outcomes we want, optimal outcomes for our psychological and physical health and well-being, and for healing. And when we use it, we set into motion mind, body, behavior, emotion, and brain changes that then contribute to the experience of our best self.
Can you tell us about the practice of mental imagery in the treatment of trauma?
Absolutely. Jodina, I've developed a technique. While many people think that visualization is imagery, it is. The mental imagery, in fact, is experienced in all the senses. And so I've developed a technique specifically for trauma where there are three distinct types of mental imagery. There, of course, is guided imagery for relaxation, but there's also discovery of images and altering of images. So when a person is healing from trauma, it requires that there's a lot of safety and relaxation in the practice. So that's, of course, a prerequisite. Another prerequisite for using the imagery, the three different types of imagery, you might want to start out with guided imagery just to relax and get used to pretty much just using images. But the relaxation is a crucial component to the mental imagery process across the board. And with the discovery of images, for instance, when that person, when they're on their continuum of healing, it might be an appropriate time, early on or maybe later on, that they would then use the discovery process, which would mean they could uncover images that could contribute to behavioral or mood disturbances that they weren't aware of. So it can uncover some kind of unconscious material as well. And so the altering of images is a technique where, again, when the person is ready with safety and relaxation in place and their comfort level with relaxation is established, then they can actually go back and change images that are counter to what the traumatic experience was, to be empowering for themselves. And the really cool thing is that the person is their own agent for change. That's the power of the imagery practice.
How do you practice this with your patients?
Well, I teach them both. I have individual practice and in workshops. I teach them to appreciate first the importance of relaxation with imagery, because we all know, or not all of us, but many of us know that alpha theta state is optimal for suggestion, for creating images, because when we plant the seed for an image, we're tapping into our own inner wisdom, and that inner wisdom has all the answers. And so we're creating something that's especially unique for us, for healing. And so with trauma, changing and altering an image is something that the person knows to be empowering to them. And so they're the one that's creating that change in the image. Now, is this negating the original trauma that happened? No, not at all. But what it does do is it serves relaxation in the body. It serves to produce a physiological response that's relaxing, that's counter to what the original trauma was. And in addition to that, it also serves to set up the person to be thinking differently, because they're empowered, because they've created an image that's no longer the same flashback or no longer the same repeated image of the trauma that they experienced. Does that make sense?
Yeah, this is a lot of information and it's fascinating. Where can we find more?
You can find more on my website, and that would be www.dr-michellewarfield.com. And the website has an explanation of all the upcoming workshops. And so I do the workshops, and I see people also in private practice.